saying that. Newborn medications.
Newborn medications.
So there's 3 medications that are typically going to be offered to your newborn when they're in the hospital setting, and we want to tell you about them so you can start thinking about whether you want them, you want to decline them, and what they mean, and you can make some decisions about them ahead of time.
So these medications, the nurse should talk to you guys about, hopefully, there's time before your baby is born, but they will be given within the first 2 hours of life. Yeah, so the first medication that we want to talk about is erythromycin eye ointment. Jen and I say it differently. I say erythromycin, she says erythromycin.
So true.
Like a urethra?
Is that wrong?
Oh, I have no idea.
Oh.
No idea. I think it's probably more proper, honestly.
I like the way you say it.
Erythro.
Erythro.
Mine sounds like a...
That's like a rodeo.
I notice that every time you say it, I'm like, oh, have I been saying it wrong?
And now I'm going to think about urethra every time. Erythromycin.
Erythromycin. Mm-hmm. So erythromycin eye ointment is a antibiotic ointment that helps prevent infections from the birth process. It's just a one-time dose that just goes on each eye. It's not invasive. It doesn't hurt the baby at all. And it'll just absorb and clean things out after your baby is born.
Yeah, and then the next medication that they'll offer is the vitamin K injection, and that is given as an injection in the newborn's thigh. It's vitamin K, so the reason that we give it is because babies are not born with a lot of vitamin K. They're going to get that through their nutrition, whether that's formula or breastfeeding. They'll get vitamin K eventually from that, but in the meantime, when they're first born, they don't have a lot of it, and vitamin K is really important for us to make blood clotting factors in our bodies. And so without that, sometimes babies can have little bleeds that happen that we don't know about. It could be anywhere in the body. It could be in the gut, in the brain. It could cause all kinds of problems up to and including death, which is scary. So what we're trying to avoid by giving this medication, it's one time, and we're trying to avoid vitamin K deficiency bleeding. So if you do decline this medication, they often will have you sign an official document, like a declination, just saying that you understand the risks of not having that medication, just because there are some serious risks.
So the hepatitis B is a 3-shot series, and they will offer the first one in the hospital within that first 2 hours of life. You don't have to get it. You could get the first shot at the pediatrician's office, but this is another injection. So typically if you get the vitamin K and the hepatitis B, they will do one shot in one thigh and one in the other. And
Yeah, and then you'll get the next 2 at your pediatrician's office, or you can wait and do all 3 there. So you just let them know what you want.